Bravo.
The United Nations Children's Fund, in collaboration with United States Agency for International Development (USAID), has donated dozens of hand washing stations and waste bins to various health facilities across the country to fight against COVID-19 and other infections. The presentation of these materials was done at an event at Farafenni General Hospital in North Bank region. The event was attended by UNICEF representative Jonathan Lewis and US Ambassador Sarin L. Kroma respectively. This event was used to remind people about the importance of hand washing with soap as an easy, effective and cheap way to prevent diseases and save lives. UNICEF supports national hand washing campaigns and help integrate hand washing in other existing programs like health, education and nutrition in over 90 countries. Speaking on behalf of the Health Minister, Lamin Fadara said Dr. Lamin Samate acknowledged the relentless partnership and collaboration of UNICEF and USAID through its ministry.
We are here again to inaugurate the opening of 22 hand washing platforms which are constructed all over the country. The very presence of the eminent individuals assembled here this afternoon has clearly demonstrated the absolute importance of this event. The government of the Gambia recognized that safe water, improved sanitation and hygiene are essential in the improvement to the people's health and development and in contributing to the attainment of the targets under Sustainable Development Goal, particularly 6.2.1. Proportion of population with hand washing facilities with soap, water available on premises.
As part of the ongoing partnership to help preserve the good health and future of the Gambian people, the United States Ambassador Sarin L. Kroma emphasized the importance of hand washing as pivotal to prevent diseases.
On infection prevention and control of COVID-19. We want everyone to hear the message that hand washing saves lives. Today's hand washing is part of the U.S. government's continuing effort to prevent illness in the Gambia and around the world. Since the start of the pandemic, the United States has led the global fight against COVID-19. To date, the United States has responded in more than 120 countries with over $9 billion in funding toward the fight against COVID-19. Here in the Gambia, we recently provided $500,000 in supplies to help the Ministry of Health to respond to COVID-19 and other health emergencies. This was part of a broader $2 million project funded by the United States to help the Gambia with vaccines, communication efforts, community engagement, sanitation, and access to safe water.
Meanwhile, representative of UNICEF Jonathan Lewis says women leadership is fundamental and essential to the community, saying during the COVID-19 campaign, 2 women were vaccinated against COVID, which shows a clear indication that women know what is best for the society. In this regard, he urged the women to also mobilize the community to fight against measles and rubella.
Disease that can cause death in children, and it is a very important effort that we're undertaking now with the Ministry of Health to ensure that all children under the age of 5 years are also vaccinated against measles. So the same leadership, women of the Gambia, that you demonstrated to encourage people to get vaccinated against COVID, we want to see the same energy and the same motivation to get your children vaccinated against measles. So please spread the word. For me, as representative of UNICEF, it really is a tremendous honor to be here today to hand over the hand washing stations to the Ministry of Health and the Department of Water Resources. In total, thanks to the very generous funding provided by the United States Agency for International Development, we have been able to construct a total of 22 permanent hand washing stations, each of which contains, or each of which has, a total of 6 hand washing taps. These are being distributed or have been built, 5 in the Upper River region, 5 in the Central River region, 5 in the Lower River region, 2 in North Bank West region, 3 in North Bank East region, and 2 in West Coast 2 region. All of them are fully functional as we speak, and they will provide safe and clean hand washing water.
Regional Health Director Abdullah Jaju applauded the support of UNICEF in 2022 as the region was able to train 69 health workers and 83 support staff on prevention and protection control. Binta Jallo, a beneficiary speaking on behalf of Women Association, also says the support of UNICEF cannot be overemphasized as cleanliness is essential, especially to pregnant women and children. Meanwhile, according to a report in Gambia, 61.8% of the population has access to improved sanitation, with 1% still practicing open defecation and only 30.9% of the population practicing hand washing with soap and other detergents. Reporting for N24, I am our MCC.